Doctors at Edmonton's major hospitals are calling on the provincial government to declare a state of emergency, saying there's no more room to safely accept patients. The call follows the death of Prashant Srikumar, a 44-year-old father of three who died on December 22nd after spending 8 hours in the emergency room. A state of emergency would grant broad temporary powers to protect public health, allowing, for example, the allocation of emergency funding and the ability to coordinate the delivery of health services. With me now is Dr. Paul Parks, NER physician and president-elect of the Emergency Physicians section of the Alberta Medical Association. Thanks for being with us today.
Yeah, thanks for having me to talk about this difficult topic.
You are an ER doctor in Medicine Hat. How bad is it?
It's bad. It's bad across the whole province, I have to say. So this kind of plea to our government, it's on behalf of hundreds of emergency physicians, internal medicine physicians, our docs working in the hospitals across the province. Our Edmonton corridor is in a bit tougher state, but actually every one of our major emergency departments is having trouble struggling to give safe and timely care to the patients that are showing up in our emergency departments, but then again, coordinating care for sick patients outside of the zones or corridors that need to come into the overcrowded areas.
Why is it so bad? We've been hearing about a widespread outbreak of influenza A across the country. Is that it, or is there something else at play?
Well, I want to stress really strongly and upfront that influenza has made our broken system a lot more broken and a lot worse. But we knew it was coming, and we've known for months that it was going to be a difficult influenza season, and undermining our public health response and access to vaccines and a lot of things that have happened over the last couple of years hasn't helped. But no, a big part of this now is absolutely every single day in our big hospitals, they're just severely overcrowded. We have hospitals that are at 120% capacity. Some of our internal medicine wards are 150, 170% capacity. We have in our emerge departments, in the Edmonton zone, for example, we have a number of our emerge departments currently today have more admitted patients and consulted patients that need admission that are stranded in our emerge department currently right now than we do actual funded spaces to take care of emergency patients. So as an example, at the U of A, they have approximately 70, 75 admitted and consulted patients in an emerge department that normally would have 65 beds to take care of emerge patients. So we're functioning, our emerge departments are functioning like hospital admission wards that can maybe take care of the odd emerge patient every now and then, and it leads to the tragic cases that we've heard about, and that tragic death is just one of many that we see every day. So this is a desperate plea to our government. We need provincial response and coordination, and we need to be able to do better for all of Albertans across the province.
And what has been the response from the government so far?
Well, I mean, sadly, the only thing we heard yesterday was downplaying of the crisis. So what we desperately need right now is to hear from the Premier and say, listen, acknowledge it is a crisis. Acknowledge it is a state of emergency, crisis, disaster, whatever word you want to say that describes that the demand is outstripping our ability to supply care in some fashion. And so acknowledge it and then say, hey, which of the many ministers of health that you have and many CEOs you have and all this disintegrated, disorganized healthcare system, who's going to lead the response? What resources are you going to give them? And then how are we going to, we have solutions. We have excellent provincial solutions that we could use right now in a provincial manner if we could just acknowledge that it's impacting care and no one hospital or one corridor can deal with it on its own. We have to do this in a coordinated, collective manner across the province.
Dr. Paul Parks, thank you for your work on the front line.
Thanks for talking about this.